Welcome to No Place Like Home, coming to you on Pinellas County Connection TV. The sponsor of the show is the Housing Finance Authority of Pinellas County. The HFA helps first-time home buyers in Pinellas, Pasco, and Polk counties achieve their dream of home ownership. Working through a specialized group of lenders, the HFA offers a low rate on its 30-year fixed mortgage and helps with down payment and closing costs, too. Please visit our website, www.pinellascounty, all one word, .org/HFA as in Housing Finance Authority. For more information or comments about the show, please call us at 727-223-6419. I'm Carmen Lemberg alongside Julian Hills, your host for today's show. Hi, Julian. How are you today?
I can't believe we're here and it's December.
I can't either.
I mean, I feel like we were here last December just a few weeks ago.
I know. It's unbelievable. The years just go by.
Yeah, they do. The hairs on my head would tell you that.
You're so funny.
But enough about me.
Oh, gosh.
Before we get started.
I wanted to just mention a special program. It's through Better Living for Seniors, and it's called Silver Santas. And on the screen, you'll see their website, which is www.blspinellas.org. And there's a link for Silver Santas there. Their goal is to provide gifts during the holiday season to isolated and low-income seniors in the community. I'm hoping that everybody will take just a few minutes to go on and donate to this program just to bring a little bit of cheer to the seniors in need in our area.
They definitely need it. Everyone needs it, but they definitely need it.
Everybody needs it.
Well, it's my pleasure today, speaking of in need, someone who is very integral in this county for helping people in need. I'd like to introduce our guest, Daisy Rodriguez, Director of Human Services here in Pinellas County. Daisy has been with the county for 3 years and has a strong background in healthcare management. Good morning, Daisy.
Good morning. I'm happy to be here. Thank you for having me.
We are so glad to have you. So Human Services provides many services to the residents of Pinellas County, and we're hoping to touch on a couple of those services today, the Pinellas County Care Fund and the Adult Financial Emergency Assistance Program. So will you tell us a little bit about the Adult Financial Emergency Assistance Program first?
Sure. It's my pleasure to share that with you. So the Adult Emergency Financial Assistance Program, as we refer to as AEFAP, is a program that's intended to help adults who qualify for the program with some unexpected financial burdens, events that sometimes may lead them to have difficulty meeting their rent payments, their utility payments, other kind of basic need payments. Individuals are encouraged that if they're in that kind of a situation, that they can call 211. There is a screening process that takes place. There are some criteria. So it has to be adults with no minor children in the home. The ages are between 18 and 64. They have to be at or below 200% of the poverty level. And there has to be what's considered a qualifying event. And when you call 211, they can help you talk through or discern whether that's actually fits the criteria for a qualifying event or not.
So the 211 is the best way to access the program, but what should a caller say when they call in? What should they, to trigger that, to get into what they need?
So they would call 211 and say exactly that, is they're looking for financial assistance with either rent or utilities or whatever it is that they're looking for.
Okay.
And it really is about just requesting financial assistance through 211. There is a dedicated team that works just on the AEFAP program.
Oh, wonderful.
And I can definitely say, working here with the county, I've met citizens who've been helped. I once remember meeting a gentleman who rode public transportation and somehow lost his paycheck. And that was the paycheck that would have covered his rent.
Right.
And he said, without AEFAP, he would have been out. So
Wow.
I can attest that, I've met people who...
Yeah, and we've had individuals that maybe there's an unexpected hospitalization or a hospital bill, or their car breaks down and that's their means of transportation and they have to pay for the car, so they get behind in some of their other basic needs. So those may be some of the things that would be considered for AEFAP. And you talked about serving people. So I have here, if I may, so AEFAP has served 3,198 unique clients since its inception a couple of years ago. So it does have a significant impact. It's doing great things in our community. And we're very proud of the program, along with the partnership that we have with 211.
That is Wow, 3,000 people.
Yeah.
So that tells you, what kind of needs are out there in the county and how, important services like this are.
Absolutely.
So,
That's great.
What are the hours that calls are accepted and processed for this program? And is there another number that citizens can call to determine if they qualify or not?
So the hours are 7:30 to 6. The best number to call is the 211 number, just directly through 211. And as I said, they have a dedicated team there who is specific for AEFAP requests.
And it's one time a year, right?
It is one time a year.
Okay.
Yes, sir.
So, just to let people know.
Yes.
That's a good thing
Yes.
to know. Yes, definitely. All right, so let's switch programs now. Why don't you tell us a
Okay.
little bit about the Pinellas County Care Program?
So the Pinellas County Care Fund program is another way in which to help some of our neighbors. We have collection boxes, I call it a collection box, at the airport, and it's where people can drop some of their spare change or some of their spare dollars, if they like, before they're going through screening. It's another avenue by which individuals can access some help for basic needs like utility and water bills.
And, this is the time of year where people get really busy. They're buying gifts and they're doing a lot of things. And sometimes these times of year, donations go down. So, while people are out and they're shopping, they might have some spare change, or are there any other sorts of items that CARE takes that people can, while they're doing their shopping?
So CARE is really about donations,
Okay.
monetary donations, and you talked about spare change. And, the spare change does add up. So those nickels and dimes and quarters or those 50 cents, if we get enough people who are doing that actually adds up. And I have some more numbers for you. So on the CARE Fund, we've collected since FY15 approximately $7,000.
Oh, wow.
And have helped 11 clients since its inception.
Now, what kind of help does CARE offer? Like, how is that different from AEFAP, maybe?
They're very similar.
Okay.
It's just another venue for us to be able to collect some additional dollars. It's more basic, so you could see that with the money that's collected here, we can't really start paying rents and stuff like that, but we can certainly help with some of the more basic kind of needs.
And those would be?
Water bills, utility bills, that kind of...
Now, you mentioned that there's a drop box at the airport, but is there any other way that people can donate?
There absolutely is, and thank you for asking. So, people can donate through the PinellasCounty.org/donate, and that'll take you to a link where it'll allow individuals to go ahead and make a contribution or donation.
That's great, because I know I don't go to the airport during the holidays. I
Yeah.
steadfastly avoid airports. So that way people who are like me don't go to the airports can still participate in the program.
Excellent. So let me say that one more time. So if you'd
Please.
like to donate, it's PinellasCounty.org/donate.
Perfect.
And every dollar counts.
Yes.
Every dollar can make a difference. So
does.
It really
I encourage
does.
everybody, if you have some spare change or if you're looking for an opportunity to donate to some cause that's worthwhile, please consider the Pinellas County Care Fund.
Because every little bit helps. And we definitely have the need in our community more than, I know we have a lot of programs, but every day I talk to people who still just can't find a good program, can't find what they need. They're out of funding. So we definitely need to just, give back. It really makes a difference. We had talked about before the show a couple of other programs that you had that I was hoping we could talk about, and that was the your health care program and health care for the homeless. Can you give us some overview
Sure.
on those two programs too?
Sure. So our healthcare program is, again, for eligible adults. It's ages 18 to 64. We partner with the Department of Health. The Department of Health has 6 medical homes in where they will see our clients. They are eligible to receive, once they are eligible for our program, and there is an electronic application online that people can apply. Case managers in our offices will pick that up and work with individuals to determine if they're eligible for our program or not. Once they're eligible, they get what's called the Blue Card. It's what most people know, our program plan. And then they can go ahead and make an appointment and receive primary care services at any of the DOH locations, specialty care as indicated, also access to pharmacy and prescriptions as needed.
Boy,
So
that's
it is a
big.
comprehensive health program. with many, many benefits for some of the individuals who might not otherwise have an opportunity to access care.
Is dental included in that?
Dental is included in there as well.
Wow.
Yeah.
Contact number, website for that?
The contact number is 727-464-4200, and that's the main number to our Human Services Department.
Okay.
And again, one would have to do a formal application, and eligibility would need to be determined before making any appointments.
So what are typical clients of this program? Well, like, what is their eligibility? Like, what things would make them eligible?
So eligibility really is around assets and income. So there are very specific criteria around that. You have to be at or below 100% of the federal poverty level. And then there's a whole formula that the team does in regards to assets to determine whether you're eligible for the program or not.
So
For the most part, these are individuals that would not have access to any kind of plan otherwise, and therefore would not have access to medical care.
Okay.
Especially primary care, right? Because
Yes.
if we can prevent it up front in the long run, it's going to cost all of us less money.
lot less.
And this can be more than just a single person. There might be like 2 people in the household.
Yes, but we only treat the adults.
Okay, no
so
children.
only the adults would be seen through our Blue Card program.
Okay. And so what is the difference between that and the homeless?
So the Healthcare for the Homeless program is an FQHC, so it's a federally qualified health center.
Okay.
It is a good portion of it is funded through HRSA. And we have 2 very specific dedicated areas. We have our MMU van, our mobile medical unit van, which goes around the various soup kitchens and shelters, and it meets homeless individuals where they are, right?
Oh, that's great.
So it's not like the homeless individuals have to come to us, although we do have a bricks and mortar building that I'll tell you about in a minute. But we go to where, to the shelters. We go
It
to
makes
them
more
to see,
sense.
work around their needs and bring health care to them. The van also has the capability of doing primary care services. It's staffed by a mid-level professional. We have nurses there. We have clerical staff who can help with the eligibility or any questions or follow-up
Wonderful.
appointments. If there are any specialty care appointments, all of that can be managed through and on the van.
Wow.
Yeah.
That's
and then
amazing.
2 years ago, we opened up the Bayside Clinic, which is on 49th Street, right adjacent to Safe Harbor. Bricks and mortar, state-of-the-art facility, really a beautiful building where individuals can go as well. Homeless individuals can go as well and receive primary care. Again, referrals to specialty care, et cetera. At Bayside Clinic, we have evening hours. So it's Monday through Thursday, 8 a.m. to 8 p.m. Friday is 9 to 5. And we also have Saturday mornings from 8 to 12. So, again, there's
Wow.
increased access. And for those individuals, if they've missed a van when it's going to be at their shelter, they always have the opportunity to then go into the Bayside Clinic and be seen as well.
So I'm sure that the shelters kind of keep track of when you're going to be where in the county so they can let the people that come to their facility know, okay, on such and such a date they're going to be here. So if you need
Yes.
something, please come in that day. And,
Yes.
and does the van usually stay there all day?
The van stays there all day. So we do have, we share on a monthly basis. There is a calendar, and the calendar is on our website, on Human Services website as well.
Okay.
So the calendar is there. It says exactly where the van is going to be during what hours.
Amazing.
If there's any change for any reason, the van is very dynamic. So in real time, the schedule will be changed and uploaded. So at any given time, people will know where the van is to be located at.
Now that is a fantastic
Yeah.
service.
Fantastic. That
Yeah.
is.
That is amazing.
It really is a needed service, and we're
Very.
very happy, again, partnering with the Department of Health, great partners to be working with, to provide the care for, again, otherwise individuals who may not access care at all. At the Bayside Clinic, we also have 2 dental suites.
Awesome.
So,
Awesome. That is
people
great.
are able to get their primary care and some dental care as well.
And then, of course, there's the income qualifications as well on that.
Not for the healthcare for the homeless. So we do try to collect income data because, the funding providers want that. But it is not income based.
Oh, good.
So you do
It's
have to
just-
be a resident of Pinellas County. You have to be in Pinellas County
and be homeless.
and be homeless.
Well,
Amazing.
That's it for today's show, but I'm so glad that we had this conversation because I'm sure there's someone who's watching this who might know
That's
someone who
great.
needs it or
Yep.
might need it themselves.
Yeah.
So thank you. I'd like to thank you, Daisy, with Pinellas County Human Services for coming today.
Thank you. It's been my pleasure and a privilege to talk to you about our program.
Yes, thank
Thank
you.
you.
We feel privileged that you're here.
do.
So
Thank you.
thank you so much. We look forward to having you join us next month if you watch this monthly. If not, if this is your first time, join us next month. If you missed any part of this show or would like to view past shows, check out our website or catch us on YouTube. I'm Julian Hill.
I'm Carmen Lemberg.
Thanks for joining us and make it a great day, everyone. Thank you guys so much.
Thank you.